Pediatric electrocardiogram is different from that in adults in many ways. The difference is mainly because of the anatomical changes of the heart after birth. In newborn baby, the heart is right ventricle predominant, while the heart in the adult is left ventricle predominant. The transition from the right ventricle to left ventricle dominance will account for the serial changes which are obvious in the first 3 years of life. At birth, the ventricle is thicker than the left ventricle. There is such a large increase in the left ventricular mass during the first month that by the end of that month, the left ventricle is heavier than the right ventricle. If you look at the slide, you can see that at birth, the left ventricular to right ventricular weight ratio is 0.8 to 1. By the end of first month, this ratio increased to 1.5 to 1. The ratio reached about 2 to 1 by 6 months of age, while in adults, this ratio is further increased to 2.5 to 1. So, the electrocardiogram will reflect these anatomical changes. By 3 years old, the child will show electrocardiogram pattern similar to that in adults. There are several general changes with increasing age. The heart will gradually decrease with age. In newborn period, the normal range of the heart rate varies from 110 to 150 beats per minute, which will gradually decrease to 60 to 100 beats per minute by 6 years old. Apart from the heart rate, all the duration and intervals increase with age, like the PR intervals, QRS, and QT intervals. This slide shows you the lower limit of normal PR intervals according to the ages. It will increase from 0.08 to 0.12 seconds, gradually from 3 to 16 years old. The QRS complex is also gradually increased from 0.05 to 0.08 seconds, starting from the newborn to adults, so that the QRS axis will shift from the right anterior in infants to left posterior in adults. As the RV dominance in newborn gradually transits to LV dominance in older child, the R wave to S wave ratio in the right precordial list decreases, and in left precordial list it increases with age. This is also found in the T waves, that the T waves in V1 may be upright in newborn on the first days of life, but usually becomes negative by 3 days of age. So, if you see persistent upright T in the newborn beyond the first week of life, it will reflect the underlying right ventricular hypertrophy. This is the ECG from a normal newborn infant. You can see the R wave in the right precordial list and the S wave in the left precordial list are very dominant, which is typical of the right ventricular dominant pattern. The QRS axis is over 90 degrees. In other words, it is a right axis deviation pattern. By 2 weeks of age, the S wave in V1 become much more prominent, and the RS ratio in the V6 is gradually increased. At 2 months of age, the left precordial list has already become similar to that in adults, but the T waves in V1 is still negative. This is the ECG from a 14-month-old baby. The QRS axis is less than 90 degrees. The RS ratio in V1 become close to or less than 1. The R wave is clearly dominant in V6, and there is a large QRS deflection in the precordial list, just like a biventricular hypertrophy. But remember, this large QRS deflection are normal during this transition period. This is the ECG from a 5-year-old child. You can see the adult RS progression in the precordial list in these serial changes. This is the ECG from a 12-year-old child. The adult QRS pattern is much more obvious right now. The T waves in V1 may be upright or negative. Negative P waves are not abnormal in V1 to V4 at this stage. In conclusion, the electrocardiogram in newborn and infants less than 1 month old normally will show the right axis deviation and RV dominance. Children older than 3 years old should have ECG similar to adults, and this is mainly because a transition of RV dominance to left ventricular dominance. In children between 1 month and 3 years, the electrocardiogram are intermediate. In other words, neither right nor left ventricular dominant pattern will be seen from the ECG.